now give the floor to Frontline AIDS.
Thank you, Chair. Excellencies, my name is Michelle Wazan, and I am delivering this statement on behalf of Frontline AIDS, MENARA, and SCOON, a harm reduction organization operating in Lebanon since 2003. Lebanon has been facing compounded crisis for years and is now grappling with the devastation of war. In times of crisis, the rights of people who use drugs are deprioritized or forgotten. Yet, as highlighted in the UNODC's World Drug Report, as well as the OHCHR 2023 report, crisis and conflict increase both substance use and the risk of developing a substance use disorder. The European Web Survey on Drugs, conducted in Lebanon in the summer of 2024, found a rise in cannabis and cocaine use among individuals who have been affected physically or psychologically by the airstrikes. Crisis also fuels gender-based violence. As we've seen during COVID, Lebanon's financial collapse, and during war, women, particularly those from marginalized groups and gender-diverse people, face heightened risks exacerbated by the criminalization of drug use. UNODC, UNAIDS, and the WHO, as well as civil society and communities, have emphasized the link between gender-based violence and substance use, with women who use drugs being up to 24 times more at risk of violence than women who don't. Yet, this remains overlooked in policy responses. Similarly overlooked in policy and practice are the sexual and reproductive health and HIV-related needs of women who use drugs. To address these overlapping vulnerabilities, in line with the commitments made in the ministerial declaration to leave no one behind, and to encourage different UN entities to contribute to addressing the world drug problem, a coordinated UN response is essential, one that meaningfully involves human rights and humanitarian agencies. Harm reduction must not be an afterthought, but an integral part of humanitarian and GBV response efforts, and must receive adequate funding. Incarcerated individuals must also not be left behind. A recent study conducted by MENARA on harm reduction services for women in prisons across the MENA region highlights the severe gaps in access to essential healthcare, including HIV prevention, OHE, and mental health support. Women in detention, many of whom are incarcerated for drug-related offenses, face heightened stigma and gender-based violence, with little to no protection or tailored harm reduction interventions. These findings reinforce the urgent need for gender-responsive harm reduction strategies and prison reform that prioritizes the health and rights of women who use drugs. Finally, repressive drug policies perpetuate harm rather than reduce it, pushing already vulnerable populations further into cycles of violence, poverty, and exclusion, and increasing their risk of acquiring HIV and other blood-borne viruses. We therefore urge member states to decriminalize drug use as a necessary step to protect the rights, dignity, and well-being of women and gender-diverse people. Governments must shift resources away from punitive drug enforcement and invest in community-based health and harm reduction. Thank you.